Here, right? Good afternoon, everyone. It's good to see your lovely faces. I hope we're enjoying the sun. Okay, so I just want to start by saying thank you for joining us here today. You know, we're always glad to host you and welcome you to all our workshops. I have a couple of announcements to make and some notices. As usual, please ensure your mobile devices are placed on silent so you don't disturb the person sitting next to you. Um, Additionally, just to say that we have toilets in the building and it's at the back to your right. Also, just to say that we are actually live streaming and the session is being recorded. So if you don't want to be in the frame or in the video, just let us know and we can sort that out. And also you can watch our past workshops on our YouTube channel. Yeah, just to keep in touch with what we've done, what we've been doing this year so far. We would have our blood pressure checks at the end of the session, and it's going to be done in the next building. Once you come out of here, the building to your left, just walk in there and go upstairs. Our team is already set up to receive you. If you also want to meet with the breast cancer screening team after the session, we are all set up to receive you. If you have questions, one-on-one conversations, we are available to cater to your needs. Yeah, we have we just started our summer clinical outreach sessions in Brixton Market. So we've had the first one done last week, and the next outreach is going to be on the 6th of June. So please come join us. We're bringing the clinic to Electric Avenue. We have clinicians, we have mental health specialists, we have the lung cancer screening team who is going to be with us, and many more people would be there to attend to you and engage with you. Just to also say that, next slide, please. Our next workshop will be on the 18th of June, and it's going to be on the theme, the inner garden. You know, we want to help you to navigate the stresses of life, you know, how to manage mental stress, how to manage everything that bothers you. So this session will be facilitated by Reverend Les Isaac. So please feel free to come along, bring your friends, bring your family, and let's spend some time, you know, getting some words of encouragement and some advice from the Reverend himself. Now, so if you look on your chairs or on your seat, there's some pink, bright. There's this bright pink paper on your seat. So it's a QR code. You know, it's our custom to do evaluations of all our workshops just to help us to know what we've done right and where areas of improvement. If you have your phone, provided is on silent, you can scan the QR code. It takes you straight to the the forms, the feedback forms to fill. Now, the feedback forms is divided into two parts. There's a part that you will fill right before we move into this workshop session, and you will come back again after the workshop to complete it. So I'm going to give you a couple of minutes, about 5 minutes to do that now. If you need help from us, please let us know. We can help you to navigate using the QR code to fill the form. Alternatively, if you find it challenging using the QR code, we have also provided the paper versions and there are pens on your seats. You can also use that to fill in the feedback forms. There are also indicator paddles on your seats, you know, the red and the green signs. Please don't take them home. we are going to be using it as we progress with the workshop. So we'll let you know when you have to bring them out and raise them to do some activities. All right, thank you. So you have 5 minutes to complete the pre-workshop evaluation forms, yeah? Thank you. still come back to it after the workshop. So without further ado, let me just welcome our breast cancer screening team from the Southeast London. Yes, so we have Jules here, we have Eddie, we have Chris, and we have Grace. So please give them a warm round of applause. Yeah, thank you.
Thank you all for coming.
Yeah. So over to you, Jules.
Thank you, Odie. Hi, everybody. I think I've said. Can you hear me okay? It's a bit echoey. I think I've said hello to most of you, but my name is Jules and I work in the South East London breast screening. I think some of you have mentioned you've been. We've got one in Camberwell on Denmark Hill. And yeah, so Odie is also, she works with us, and Grace as well. So we're going to talk a bit about breast cancer in general and breast cancer screening. You may already know a little bit about it, so that's fine, but hopefully you'll get something new from today as well. So if I can just ask you to really concentrate if possible, let me know if I need to slow down or be louder, or if you need me to repeat anything, that's fine. We have some slides and we also have some videos to watch as well. So if you do have some questions, I don't mind if you want to put your hand up when we're going through the presentation. We can try and answer some questions along the way, but we will have some time at the end as well. So we'll try and keep things interactive as much as possible. So, and thank you very much for having us and for coming. Yes. Yeah, next. Yeah, keep going. Yes. So yeah, this is just the first slide. So next one. Okay, so just to kind of get the energy going in the room, I want you to turn to the person sat next to you, and please can you talk about what your favorite word is for breasts or chest? So don't worry, you're in a safe space. If you don't want to take part in this, that's fine. If you don't feel comfortable, that's okay. But so what your favorite word is for breasts or chest? What do you like to call breasts or chest? Don't worry, I'm not going to pick on you to tell us unless you want to. Okay, so I'll give you 30 seconds or so. Oh, we have a volunteer. Hang on. What's your favorite word?
Windscreen wipers.
Windscreen wipers. Okay, I won't ask. So have a chat with the person next to you and try and get to know them if you don't already know them. And if you feel comfortable talking about, maybe it's just boobs, maybe it's just breasts, but maybe you have a special word that you like. What's your favorite word? I'm glad it makes people laugh. I was a bit worried. I can tell you what my favourite word is if you like. Mine's wangers. Has everyone had a chance to chat to your neighbour? Oh, we have some giggles. Oh, would you like to share your favourite word?
Yes. Comforter.
Comforter. Oh, that's nice. Does anyone else want to share?
No, we don't want to share. We don't want to. I call them tig old bitties. Tig old bitties. So if you swap around the T and the B, you get big old.
Oh, teak old bitties. Does anybody else want to share what their favourite word is? Don't worry if you don't want to. I'm not going to pick on you. Any more takers? Anyway, there's lots of words for boobs and breasts and what was yours again? Teak bitty. It's a bit of a tongue twister. Yes, so I think we need to normalize kind of boobs. Breast is the medical term, really, but many people have their own terms. People might want to call them chest or pecs breasts, boobs, anything. It's just what's normal for you, and we need to kind of just normalize that. Okay, next slide. I feel a bit like it's echoey. This is a really lovely video that our South East London breast screening department actually created, and it's actually, it has some residents from South East London in. Some of them have screened at the breast screening and some have gone through a breast cancer journey. So this is a nice introduction video for you to watch. It's about 3 minutes. Okay, actually, if you can just pause just a second, Chris. So I'm just going to read that out for the people that might not be able to see. So roughly 1 in 100 people coming to breast cancer screening will be diagnosed with breast cancer. And if it's you, it could save your life. Sorry, Chris. So women and those assigned female at birth, that's including trans. Oh, sorry. I can't remember what it says. Trans men and non-binary people over the age of 50 are eligible for breast screening. So as I mentioned, this features some local residents of South East London. So, yeah.
Yes, I'm Joy. My name's Amira. I'm a Southern resident. I'm also a mammographer. I've worked at King's for many years. I'm also a breast cancer survivor. When we're 50, we get the letter to go. I've got the letter. I've got the next letter. I wanted to have an apology. I couldn't read my code. I had to show examples. There's several reasons why people breastfeeding. First of all, any conditions, things like, and it is completely free. It is a bit uncomfortable, but it's 30 seconds. It found my cancer, so it's actually life-saving for me. I found it straightforward, efficient, in, out, brilliant. I had to all my treatment. I don't think I can talk to you today. So it changes all your priorities. It makes me, anyway, feel very happy to be alive. I actually got through the whole process, and I had some amazing friends who were also there to support. Breastfeeding has been really good for me. I've gone every time I've had an appointment, I've never missed one. And the staff are so highly skilled. Radiography is something you study for many, many years. And the staff are friendly, they're kind, and they just do a brilliant job. I would have found my cancer if it hadn't been for them.
Unfortunately, we can't stop ladies developing breast cancer. Our aim is to detect cancer early so that treatment is less invasive. That's our hope. Just like my mum, she was diagnosed 3 years ago and she's now living her best life. They caught it early and treatment was less invasive.
I'm currently 40 very late development at breast. They do not know that you have got anything going on. But when they come for breastfeeding, we are able to detect small cancers, which if it's detected on time, the chances of survival is higher.
Can't get this message over more strongly. Please be coming to the breast screening. Don't be afraid.
Breastfeeding saves that.
So it says, attend your appointment when invited, or if you've missed your appointment, you can call us on the hub. It's a central booking number that deals with all of the appointments in London. So I'm going to share this number again with you all today, in case after today you've realized you've missed an appointment and it's motivated you to come. Okay, next slide. So I'm just going to start by discussing what is breast cancer. So I'm going to go back to basics. So breast cancer is really when some abnormal cells in the breast, they start to grow and divide. They might start to grow quite rapidly, and then it might turn into a lump. You've probably heard the term tumor or a mass. So you can see there's a picture on the left-hand side, and this is an X-ray, a mammogram of somebody that has breast cancer. Can anyone see where the breast cancer might be? Does anybody want to shout it out? Yeah, at the top. Yeah. What? Should I point? Yeah. 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 It's actually this kind of mass here, this lump. Yes. So this is what the breast screening actually detects. So when somebody has these abnormal cells and they've started to grow, usually it starts in the lining of somebody's milk ducts in their breasts. But if it's left untreated, breast cancer can spread to other parts of your body, and sometimes that can be too late for us to do something about it. So just as the video was mentioning with our residents, some of them were saying that they caught the breast cancer early enough and they've survived. So early detection is really, really important because it really does save lives. Next. So we're going to talk about how common breast cancer is in the UK. You might have seen these figures before, but it's actually now 1 in 7 women or someone that's assigned a female at birth is estimated to have breast cancer. So you think of maybe there's about 14 people in this room, and maybe half of us may be at risk of breast cancer at some point in our lives. And it's quite a high statistic, so 1 in 7. So that's roughly about 55,000 women diagnosed. But actually what's surprising is men can also get breast cancer. And so 400 men every year are diagnosed with breast cancer. Is anybody shocked at that or surprised? Yes. What was shocking about that?
I thought it should be something to worry about prostate.
Yes. So, yeah, you assume different cancers for men, like prostate. Yes.
Does that mean men have got milk duct also?
Is there any medical people in the room? I don't. I'm not sure if the men have actually got milk ducts, but they have breast tissue. Sorry, were you going to say?
No, that was the question that I was.
Yeah. So men can have breast tissue. So that can also still develop in their breasts, even though they may not have as much breast tissue as women. Men can still get breast cancer, but it's less common. So most of the breast cancers are in people age over 50 years old. So it's about 44,000 women are diagnosed over the age of 50. But that doesn't mean that people under 50 are not at risk. We're seeing now, maybe you've seen it in the news, I think the BBC News was reporting there's cancers are appearing in a lot younger people these days, including breast cancer. So it's about 5,000 women under the age of 45 are being diagnosed with breast cancer every year as well. So, yeah. And as we were talking about before, the early detection saves lives. But if people don't find that cancer early enough, then they could die from a later stage of cancer. So it's about 11,500 women and 90 men every year die of breast cancer. But the good thing is 25% of breast cancers can be prevented. So we're going to talk a little bit about that as we go through. Next. So back to basics again. What is breast screening? I know some of you might already have some knowledge. Some of you have probably already been to your screenings, which I hear. So the test is to check if your breasts are healthy. And the test can find those very small changes inside the breasts that are too small to see or feel. So it's often before anybody notices any symptoms, the test will find something very, very small before it develops into a bigger cancer. So yeah, the small changes can eventually grow and it can become a cancer. Next. Just checking, is everyone understanding me okay? Do you need me to slow down or be clearer? I do have a northern accent, so I understand if you, yes.
Is it exclusively in milk ducts that it starts from, is it?
So I'm actually not, I'm not a nurse or a doctor, so I'm not sure I can answer that question for sure, but I can find out for you if that's okay after. In women, usually the cell changes start in the milk ducts, but for men, I'm not sure. Yep. No, they don't. But I'm going to. Okay, can we come on to that when, okay, great, it's a very good question. Yes, yeah, great, thank you for the question. Okay, so we're going to talk about the test. Do you remember I showed you the mammogram, the photo of the lady with the lump in the breast, the x-ray? So we're going to have a talk about what a mammogram is. Has everyone heard of mammogram? Yes, don't worry if you haven't. It's just the medical term for an X-ray for the breast area or the chest area. Yes, we're going to watch a video of what a mammogram is.
Hi, my name is Letitia, and I'm a mammographer. Breastfeeding uses X-rays called mammograms to look for cancers, including ones that are too small to see or feel. Your local screening service may be in a hospital or could be at a mobile screening unit elsewhere. Your breastfeeding appointment will always be with a female mammographer. You can ask any questions at any stage of the screening. Before your appointment, don't use any deodorant, antiperspirant, or talcum powder under your arms or on your chest, as this may affect your mammogram. You'll be given privacy to undress from the waist up. You'll be called into the X-ray room, where your mammographer will explain what will happen. Your mammographer will need to touch your breast to help get it into the right position on the X-ray machine. Your breast will be squeezed between two pieces of plastic to hold it in place. You'll need to keep still. You may find this uncomfortable or painful. Any discomfort shouldn't last long, and you can ask to stop at any time. You'll usually have 2 X-rays taken of each breast, one from above and one from the side. Once your X-ray is finished, you'll be given privacy to get dressed. You'll usually get your results within 2 weeks of your breast screening appointment. If it takes longer to get your results, it doesn't mean anything is wrong. If further tests are needed, you'll be given an appointment. Most people who need further tests don't have breast cancer. Breastfeeding can detect cancer before you can feed it. Finding cancer early can make it more likely the treatment will be successful. If you have any mobility or learning difficulties, let your local breast screening unit know before your appointment so they can support you. Contact your breast screening service if you can't attend your appointment and need to rebook. Their contact details should be on your invitation. For more information on breast screening appointments, visit the NHS website.
Thanks, Chris. So what did we think of the video? Do you think it's that's how it is in real life? Yeah. Is it an accurate representation? Yeah, I see a few nods. It doesn't look too bad. What do we think? Yes. So as the video mentioned, it will always be a female clinician, a female mammographer that will do the screening, because sometimes that might put a lot of women off coming. So it's really important to know that it will always be seen by a female. You'll be asked to undress above the waist. So when someone comes to the appointment, it's really helpful to wear some trousers or a skirt and a separate top, so you don't have to remove your whole dress. But you do get some private space to undress first as well, and to get dressed. And as the video mentioned, each woman will get 2 X-rays of each breast. It's actually very, very quick. The appointments are 6 minutes, aren't they? Yes, 6 minutes, unless you need any extra time. If you have mobility problems, we can always book longer appointments. We have a special chair as well for people that have wheelchairs, or if people can't stand up, we have a special chair where we can do the mammogram sat down. We also have a translation and a language line for any non-English speakers as well. So yeah, that's basically a mammogram. It's a very, very quick procedure. So we're going to talk a little bit about what increases the breast cancer risk. So I know I've mentioned just before, women aged over 50, that is the highest risk population, the highest risk of breast cancer. Or if you're assigned a female at birth and you have breast tissue. The other risk factors can be alcohol drinking. There's scientific evidence and research to prove there's a link between alcohol use and the chances of breast cancer. So I think that was quite a shocking thing for me to learn, actually. Is anybody else surprised? So if someone is drinking regularly on a daily basis of alcohol or drinking over the government recommendations, which is 14 units a week. So I don't know if people know much about units, but roughly 9 units is a bottle of wine. Yes, it's not so much if you like a wine or a beer. 3 units is usually a pint of regular strength beer. So actually regularly drinking, there is a link with breast cancer as well. Also not being physically active, so not moving your body to the point where you're not getting yourself out of breath. If you're moving your body and feeling a little bit out of breath, that's a very, very good sign that your body is being active, and it's good for your heart health as well. So there's definitely links between not being physically active and breast cancer as well. I think one of the videos mentioned maybe it didn't. Hormone replacement therapy, or HRT. So a lot of women, sometimes during the menopause, they might want to start taking some HRT. And there is some links with that, with use of HRT and breast cancer. It tends to be a bit higher if you've been taking it for more than 5 years. So it's not to say if you're taking HRT, you're going to get breast cancer. It just increases your risk. Another big one, which you might have heard, is if you have a family history of someone in your family having breast cancer. So the genetics can be passed down, or the genes, which make you more likely to have breast cancer. And that's not definite again. It really just depends on the genes and what's been passed. But having a first degree relative, it roughly doubles your risk of getting breast cancer. Also being overweight, especially in the menopause, there's a link with an increased chance of breast cancer as well. And if anyone's ever used the contraceptive pill, there is a slight temporary risk of breast cancer, but when someone stops taking the pill, that starts to reduce, the risk reduces. And finally, smoking. There is some research or evidence to show that if it slightly increases your chance of breast cancer, as well as lots of other cancers as well. So yeah, so that's kind of the main risk factors. Is anyone shocked, or does anyone have a comment or a question about that? It's kind of a lot to do with lifestyle choices, but also some genetics as well. And also kind of anything with hormones, so medication with hormones in, so the contraceptive pill and the HRT, there's links. So it's not to say if you drink alcohol or you're overweight that you're going to get breast cancer, but these are the risk factors that put you at slightly higher chance of breast cancer at some point. Okay, so you might be thinking, how can I prevent breast cancer, or how can I reduce my risk? So most of it is, as we're talking about, lifestyle factors. I know this is very easy for me to stand here and say, lose weight, stop smoking, eat healthy. It's not that easy. But if it's something that you are worried about, you can make some small changes to your lifestyle, which might make a big difference, not only for breast cancer, but for other cancers and your heart health as well. So that includes trying to maintain a healthy weight. You've probably been to the GP and you've had your BMI measured, your body mass index. I think maybe you also, Odi, I don't know if do you do BMI checks here as well? The body mass index for the weight and the height. Yeah. So the BMI is a measurement of if you're a healthy weight or you're an unhealthy weight. So the next time, if you try and get your body mass index or BMI checked, and you can know whether you're within a healthy weight range. And if it's something you're worried about, you can always speak to some health professionals about eating healthily or losing weight healthily. But also the other things you can do to help reduce your risk of breast cancer is being more active and moving your body more. I was mentioning about being a little bit out of breath, so walking a bit more briskly, doing activities that make you feel like you're working a bit harder, you're feeling a little bit warm and you're a little bit out of breath. That's a very good sign. Reducing alcohol as well. And I can see we've got lots of leaflets here actually about eating healthily, reducing alcohol. So, and we have a leaflet that we've put in your bag about how to make your lifestyles healthier as well. So if you're interested, you can have a look at those and speak to your GP. But yeah, also just the other healthy eating. So reducing saturated fats. Does anyone know what saturated fats are? Don't worry if you don't. Yes, butter, lard, animal fat. Yes, very, very well done. It's usually. Oh, yes. Sorry.
Oils that get solid when you leave it, especially
At room temp. Yes, well done. It's usually a fat that when it heats up, it's liquid, but when it's at room temperature, it's solid. So things like lard, butter, animal fat. So if you've got a fatty bit of meat, usually when it's at room temperature, it goes solid. Yes. Yes. That's a good question. I'm going to have to come back to you on that one. But usually the olive oils and the vegetable oils, that's not classed as a saturated fat. But the coconut oil, I'm not sure. I'll come back to you on that one. But reducing the amount of the solid fats is very good for your heart health as well. Okay, and then I'm also stopping smoking, cutting down on processed foods and meats, and being aware of harmful chemicals that we have in our daily activities as well. So I'm going to talk about that a little bit later. Is anyone surprised to know if you breastfed your children, you have a lower risk of breast cancer? Did anybody know that? Yeah, a few people did. Yes. So actually, breastfeeding your child lowers your risk of breast cancer. So that's a good thing. So if anyone is still fertile and you're still thinking about having a child, breastfeed your baby. Okay, next. Okay, don't worry. The slides will get a bit more interesting, I promise. Just want to talk a bit about ethnicity and breast cancer in the UK, because there is some very big differences between different ethnicities. White women in the UK generally have more breast cancer diagnoses than any of the other ethnicities. Is that something that you've heard of before? Yeah? Has anybody else heard that? Yeah. Is anybody surprised? Yes, somebody's surprised. Yeah. Yeah. Do we know why that might be? No, don't worry. We'll come on to it. So the other ethnicities we have, there's some research and data that show Black Caribbean and Black African women, there's less diagnoses, but when they do get diagnosed with breast cancer, it's usually at a later stage, which means there's a poorer outcome. So even though there's less diagnoses, these women they're not getting screened early enough, and therefore they may not be able to get the treatment, and they may not survive as long as if they got tested or screened earlier. So that's also the same for South Asian women in the UK, especially Indian, Bangladeshi and Pakistani. They're more likely to get diagnosed at a later stage of cancer. So stage 3 or 4, which means they have a less chance of survival. Is anyone surprised at that as well? Yeah. Did you have something to say? No. Yeah. Yeah. Okay. Yes. But next slide. So why is there some differences within the different ethnicities? It's a bit baffling, but it mainly comes down to lifestyle changes or lifestyle differences. So between our cultures, our ethnicities, we sometimes eat different diets and different foods. We have differences in the amount of physical activities that we do. Some cultures or ethnicities, we might not drink alcohol. Some might drink lots of alcohol. And also family sizes as well. So between different ethnicities, we might be prone to having more children.
I want to ask you, where Oriental ladies, which category do they?
Yes, you're right. Thank you for mentioning that. I'm sorry I haven't put any other ethnicities. So other Asian women, they also have less diagnoses, but probably more likely to have a later stage diagnosis. There's not a lot of research on that. And maybe Chris, I don't know if do you know anything? Yeah. Yeah. It's probably very similar to the South Asian and the Black African and Black Caribbean. I'll try and get back to you on that one because it would be interesting. Yeah. But yeah, I was going back to sometimes we have different size families between ethnicities. Some like to have big families, some like to have no children. But actually having more children at a younger age actually reduces your risk of breast cancer, which is also quite an interesting point as well. And I mentioned breastfeeding. It tends to be more common amongst Black populations rather than white, but that actually helps reduce the risk of breast cancer. So breastfeeding actually reduces the risk. So that's just some of the differences. But also between different ethnicities and people, we all have different work commitments and childcare commitments, transport issues. Sometimes we might not be able to go and get screened as well. So that can also cause a barrier. Yes. The work and the childcare, yes. So I think it's not just between ethnicities, everyone. We all have different work commitments, childcare commitments, and sometimes things might get in the way of us taking ourselves to our screening appointment. So it's more of a barrier to screening and being able to find out if we have breast cancer. So some of us might, some of us might not have access to a car or transport to get there as well. Yes.
So, like going by what you're saying, basically, rather than it being a biological issue, it's a communication issue.
It can be, yes, yeah.
And sort of like just as an ordinary bloke, to me, it seems like it's basically a miscommunication between, we can't get that, I can't get that because I'm this.
Oh, okay, yeah.
Do you know what I mean?
Yeah.
And it's sort of like, it differentiates between, colloquially white people and Black people in the sense that, you lot can't get that, but you lot can.
Yeah, and
it's communication rather than biological because we're all the same species, we're just different colours. We all have the same frailties.
Yeah, definitely. Thank you. You're right. And actually, I was going to talk about this. So it can be a communication issue, yes. In some ethnic minority groups, maybe English is not their first language. So maybe they don't understand the letter. Or maybe they don't know what the symptoms of cancer are. They don't know what to look out for. They don't have that awareness. So that can all come down to lack of communication as well. and understanding. But also it could be we have different cultural beliefs. Some of us might experience stigma. We might not trust the health service, so therefore we don't want to go. Maybe some people are worried that they will get screened by a man, which is not culturally acceptable in some cultures. Or maybe someone's had a negative experience in healthcare or the mammogram before, and they don't want to go back again. But yeah, so it's quite complex. There's lots of different things that can affect our choices, and so that might stop us from getting screened. Yeah, and especially amongst ethnic minorities, it can be quite complex. And I think you're right in saying about the communication issue. Yeah. Does anyone else have any more comments or questions? Yeah. Okay, thanks. Okay, so this is the last slide before we take a little break, and then we'll hopefully be a bit more active. So we're going to talk about the signs and symptoms of breast cancer. So going back to the mammogram, the x-rays that we get done on the breast, that's looking for very early signs of cancer that we can't see or feel. However, we should all be aware of the signs of breast cancer as well, because you need to be checking in between your mammograms or before the age of 50 as well. So it's very, very good for both men and women and anyone of any gender to know what the symptoms of breast cancer are. So this is a photo from a website called Know Your Lemons. You can go on the website as well. And the lemons are there to represent a breast or chest with a nipple and different symptoms. There's 12 signs or symptoms that you should look out for. So the first one is looking or feeling around for a thick area. So sometimes our breasts will change in how they feel throughout the month because of hormones or menstrual cycles or after menopause. But a thickening which doesn't feel right could possibly be a sign of breast cancer. So especially if it doesn't go away. The second one is a breast dimple. I don't know if you can see, there's like an indent in the lemon here. So it looks like, it's just like a dimple. That is often a sign that there is probably a tumor or a lump behind there and it's pulling the breast in. So that is definitely a sign of breast cancer as well. The third one, nipple crust. So if your nipples are kind of crusty, itchy, flaky, if they're not kind of feeling right, it doesn't go away, you should get it checked out. The fourth one, a pain or an itch in one spot. So we can all have painful breasts or chests now and again, but pain or an itch can sometimes be a sign of breast cancer, but it is usually associated with another symptom happening at the same time. So pain on its own isn't usually just a sign of breast cancer. But if a pain does not go away and you're worried about it, for your own peace and reassurance, it's always best to get it checked out. This one is fluid from the nipple. So if you're not breastfeeding, we should not be having fluids coming out of our nipples. So discharge or blood or any type of pus or anything is not healthy, and you need to get that checked out. This one here is skin sores. So if you have like an open wound, it might be oozing, it might be painful, it might smell. That can sometimes be a sign of advanced breast cancer. This one, a bump or a lump. This is the most common symptom of breast cancer, is when people find a lump or a bump in their breast. Sometimes the lump can be on the surface of the breast, or it can be deep, or it can even be behind the nipple. And not all lumps and bumps are breast cancer. They can be non-cancerous lumps. But because we're not experts, you need to go, if you have any concerns, if you find anything like that, you should go to your GP straight away, or contact your GP. This one is a growing vein. So we do have veins in our breasts and chests, but if a vein starts to become more pronounced or bigger, that can sometimes be a sign that there's a tumor or a lump there, and it's the vein is growing because it's kind of feeding the tumor. It can be quite common in breastfeeding as well. So if you're not breastfeeding and a vein has suddenly kind of appeared and it's quite prominent, it's probably best to get that chopped out. Sorry, skin feels really echoey. This one, a sunken nipple. So some people might have inverted nipples anyway, which is, if that's normal for you, that's fine. But if your nipples suddenly start to move direction, they start to kind of pull in or inwards, and it just doesn't seem normal for you, you need to get that checked out. This one is if your breast becomes a new shape or size. So it's normal to have odd-shaped boobs, maybe one bigger than the other. That's quite common. But if it's really put me off the echo. I'm stand over here. Sorry, it's echoing. Yeah, so if it becomes bigger or smaller, it droops, and it just doesn't feel like it's normal for you, it doesn't go away, then it's best to get that checked. This one is, we call it orange peel skin or orange peel rash. Oh, yes.
What does it mean when you have four? What does it mean when you have four nipples? Is that something that's sort of like weird, or is it medical?
So
Because you can have four. I've seen it during my days of when I was doing nursing, but I never really got an answer. When you have two iolas, one on each breast, what does that mean? Is that a sign of breast cancer, or is it something abnormal?
Actually, because I'm not medical, I can't completely answer this in depth, but what I do know is that some people are born with an extra nipple or an extra two nipples, and it's just, they call it an accessory nipple, which I find quite a funny word. But yes, and it just sits there, it does nothing, but it's probably best if it's just appeared to get it checked out, and then a doctor can confirm whether it's like an accessory nipple or whether it's breast cancer. Yeah, but some people are born with extra nipples, and so it is quite common. In fact, actually, I heard of a girl having 3 nipples actually recently when I was in the clinic, and the doctor just reassured the lady, it's fine, it's normal, you don't need to do anything with it. It's not a functioning nipple, it's just an extra nipple there, and it doesn't do anything else. Yeah, but I think it's always best to get that checked anyway, just for reassurance. Yeah. So yeah, I was going back to the orange peel. This is another symptom. If your breast develops like a little rash that looks like an orange peel or a lemon peel, kind of a bit dimply, it might be a different color. So in white skin, it could be red. In darker skin, it could be purpley or even very dark. So if you get a rash, it's best to get that checked out as well. Yes.
Excuse me.
Hello.
We would like to ask you if men can have breast cancer, please.
Yes, they can. Yes. So about 400 men every year are diagnosed with breast cancer. So 400 men every year are diagnosed with breast cancer, but it's more common in women, or if you've been born a woman and you have breast tissue. But yes, you're welcome. Thank you. And the final symptom is a hard lump. So these ones are quite difficult to feel because it might be very small, but it can be very hard. If you think of it like a lemon seed, this can also be a sign of breast cancer and to get it checked. So that's the summary of symptoms. Oh, yes, sorry, we have a question.
It's not a question, it's more.
Yeah.
There are less blacks than white will diagnosed because most of the time the blacks are Asians and less aware of what's going on in their breasts.
Let me come over here.
They are less aware of what's going on in their bodies.
Sorry, say that again. I didn't catch the
The
first.
awareness
Yeah.
is not there most of the time for most blacks.
Yeah.
And then sometimes the cultural issue, or rushing around with the family, they're not aware of what's going on their bodies.
Yeah,
So
you're
by
right.
the time they're aware, it's too late.
Yes, you're right. Yeah, thank you very much for that. Yeah, so sorry, what was your name?
Pat.
Pat was saying that sometimes like we're rushing around, we don't have time to check our breasts. Sometimes culturally as well, we don't have awareness. We don't know what signs to look out for. So yeah, that's a very, very good point actually. We all have very busy lives, and sometimes we don't give ourselves enough time to actually check ourselves, and sometimes we don't know what to look for. So this is great why you're all here today. So I really hope that you take away some information today. And after the break, we're going to talk about how to check your breasts as well and how often to do that. But does anyone have any other questions about symptoms of breast cancer? So it doesn't mean if you notice one of these that it's definitely breast cancer, but it could be a sign. And you won't be able to know whether that is breast cancer unless you go to your GP. So, or if you are going to your regular screenings every 3 years. We're going to talk a little bit how often that you go to the screen. Oh, yes, yeah, we have some questions. Yes?
Somebody that I know, she was very young. She had 3 children, and she was just diagnosed with breast cancer like within a couple of weeks, and she died within a couple of months. Now, I'm quite shocked at that, really, because I don't understand. She didn't have no symptoms. She didn't have any of those apples on the board.
Yeah.
So what was going on?
Yeah, it's difficult to say. Maybe it was a cancer that was very hidden, that wasn't very obvious, and so it doesn't have to be a big obvious symptom like this. It might only be something very, very small, like this small hard lump that's you can't feel. So I'm not sure. I'm so sorry about the woman was it your friend? Did you say? I'm sorry to hear that. Yeah, but it sounds like it might have been like a late stage cancer by the time that they found it. But yeah, so it might not always be obvious. So this is a even more reason to keep going for your screenings, because if it's not obvious, unless you do your screenings, that's where it can detect the very, very small cancers before it develops into something big. Yes. 50. So after the break, we're going to talk about the appointments, how you get your appointments letter, and where to go. Yes. Yes. Oh, sorry. Did someone say something? Oh, okay. Yes. So, I think actually, because you arrived a little bit after, so breast cancer can run in families. So if you have a relative with breast cancer, those genetics can pass through the family, and it might make you a higher risk of breast cancer, yes. But we'll talk about what you need to do about that. If you have anyone in your family with breast cancer, we're going to talk about that after the break. Yes?
No signs or symptoms.
The breast cancer. Yes, it can be. Yes, it can be very small, minute symptoms that are not very obvious. So it's not always like the lemons there. It can be very, very small. It can be a small lump, it can be a big lump, it can be a hard lump, it can be a squishy. Yeah. Yes. So our breasts, like they do, we do have kind of lumps and bumps, and we have our milk ducts and our breast tissue there. So we are going to feel some lumps now and again, but it's getting to know what's normal for you. If it's always been like that and it's not grown bigger, it's not got more painful, then it probably sounds like it could be normal. But if you have any doubts, if you're worried, it's always best to get that checked. Yeah, but it's normal to have lumps and bumps in our breasts. But if something doesn't feel normal for you, it's good to get checked. Yes. So any more questions before we take a 5-minute break? Hopefully it will be a bit more active after the break. Thank you very much for listening so far. If you need to go to the toilet or take a snack, or I'll hand you back to Oddie. I don't know, you might want to say something. Thank you.
So please share comments, go around.
Maybe if it was taken far away, it would have stopped there. So I need to know.
Just give us 2 minutes. Thank you. Oh, this one is reading. We know the deal now. Okay, guys, we're back to the phone pass. Someone pass the microphone to James.
How's everybody? Yeah, great. Thank you for coming back. So has everybody got one of these thumbs up and thumbs down on your chair? Is anybody missing one? Anybody need one? Yeah, pass this guy will give you a Okay, everybody's got their thumbs up and thumbs down. Okay, is everybody ready? So we're going to do an activity now where I'm going to read out a breast cancer statement, or it could be a myth. And I want you to think about whether you think it's true or false. And don't worry, if you don't know the answer, don't worry, just give it your best shot. It's just so we can generate some discussion and get us thinking. So, if you think the statement is true, you need to hold up the green thumbs up, which means yes, true.
But if you think the statement is false or you don't agree, it's the red one. Okay, does everybody understand? Everyone feel okay? Okay, so the first statement is only white older women get breast cancer. Do you think that's true or false? Oh, false. Oh, someone said true. Oh, yeah. Amazing. Yes, everyone said false. Yeah, that's actually correct. Yes, well done, you've been listening very, very well. So, as we were talking about before, anybody of any age, any ethnicity, anybody that has breast tissue can get breast cancer. So that includes women, it includes men, it includes non-binary people. So this is people that are not exclusively male or female. It can include trans men and trans women as well, if they have breast tissue. And it says, for any ethnicities are at risk of breast cancer. Next slide. Okay, and well done everyone, you got that correct. The second statement is, underwired bras can cause breast cancer. Do you think that's true or false? Okay, so you have a few truths and falses. Okay, so you have about 1, 2, 3, we have 3 people that say that, oh, we have 5 people that think that's true, and then the rest think it's false. Okay, next slide. It's actually false. Yeah, so underwire bras do not cause breast cancer. There's no scientific evidence for that at all. So is anyone quite shocked at that? You feel relieved. It's a good thing. It's a good thing. But yes, the bras do not cause breast cancer. Even if the bra wire is digging into you, that is not a cause of breast cancer. However, it can make our breasts painful, so it's a very, very good idea to make sure you get a correct fitting bra that is comfortable and supportive. Okay, next minute. So the next statement is, squeezing, injuring, being hit, or bruising your breast does not cause breast cancer. Do you think that's true or false? So having an injury to your breast, it doesn't cause breast cancer. True or false? True. Well, actually about 50-50. So about 50% of people think it causes breast cancer and injury, and about 50% of people says it doesn't. Okay, what's the answer? So true. So injury your breast does not cause breast cancer. Okay. So if you've ever hurt your breast, that is not going to develop into breast cancer. Some people might develop a non-cancerous lump in the breast from an injury. This is the medical term that is fat necrosis, but that does not mean that's cancer. But the only way you can know for sure is to get that checked out. So if you do notice something there, you're not sure if it was an injury that caused that, you should always get any lumps or bumps checked out. But most of the time anyway, for an injury, it's a non-cancerous lump. Okay, next one. Using deodorants or antiperspirants can cause breast cancer. Do you think that's true or false? We've got quite a lot of truths, quite a lot of falses. So it's about 50% of the group thinks it causes breast cancer, 50% doesn't. What would you think of this one? What's the answer? No. So deodorants and antiperspirants, there's no scientific evidence to say that it definitely causes breast cancer. There's no evidence, it's not consistent. And I think this myth has been around for many, many years. I think we've probably all heard that. Is anybody very shocked at that or surprised? Yeah, we hear this a lot actually, and yeah.
I heard that some deodorant have got some aluminium mixed with it, and that blocks the pores of the armpits. And because of that, the sweat tries to find a way, and it goes through the press, so you get the salts accumulated in the breast.
Yeah, I've also heard that too, yeah. How, yes, yeah. Yeah, I think it was in ovarian cancer. Other questions? Yes, thank you for that. I think we've all heard about yogurts and aluminium in these yogurts causing cancer, but actually scientific research has not been able to link that to breast cancer. So if you are worried that there are things you can do to kind of avoid certain chemicals in the products that you use, which I can talk about a bit later, but there's not any definite evidence or link with deodorants and breast cancer. So maybe you might have heard of this one as well. Mobile phones in your bra or having 5G, 4G phone signal can cause breast cancer. Do you think it's true or false? Say, maybe we have half the room that thinks it's true, half the room thinks it's false. Does anyone look at this, by the way? Does anyone carry the phone in the chest or bra? Oh, we have any guilty people? Yes.
It has something to do with it. Yeah. I think the
Radiation.
yes, on the phone has something to do with it.
Oh, okay. Okay. So let's see the answer and see, because I think people get scared with the 5G, 4G, and the radiation on Bluetooth, the signal from the phone, people get worried that's linked to cancer. But actually, it's not true. So, yeah, it's not true, it's false. I know it's quite shocking because I've also lived in these rooms too. Yeah. Oh, guys, can we keep it quiet so we can hear? Sorry.
Yeah, I can understand. You put the phone on your body. The radiation from the phone can make you.
Yes, so the scientists, they've been looking at that, where there's a link between the mobile phone being close to the body, and they've not been able to prove that there's a link between cancer and the phone. So at the moment, I don't think you need to worry, but the scientists, they are still looking into any longer term effects. So if it's something that you are worried about, you can stop carrying it in your bra. But at the moment, there's not any solid scientific evidence that links mobile phone use to cancer. But yeah, it's I've also heard this rumor, this myth a lot. Yeah. Everyone very surprised at that. But we hear lots of different myths, don't we? So the next statement is breastfeeding is painful. Even the men in the room are saying yes. So put your thumbs up or down. What do you think is true or false? Is it painful? Okay. So then some people say, the majority of people say yes, it's painful. There's a few people that say no. What do you think? So actually, it depends. Yeah. It depends on the individual person.
It's true.
Yeah.
Because someone there is a
You're all correct. It depends on your pain thresholds. Maybe it depends on where you are in your menstrual cycle, if you're still in periods. It might be people who can tolerate pain better than others. But generally, it only lasts for a few seconds when you get the mammogram. And it's really important that it doesn't put people off. It's a very small temporary pain. Some people describe it like getting your blood pressure taken, the compression from the X-ray on the breast. But the mammographers are very lovely, and if you're in any pain, they will stop whenever you want. So if they won't force you to do anything, they'll make sure that you feel comfortable, happy, and safe. And if you feel comfortable, you can stop at any time. And as we said before, the appointment is only 6 minutes long. It's very, very fast. It's just a few seconds for each X-ray that's taken. So if you, and it might save your life. So I think for a temporary bit of pain, it's definitely worth it. Yeah. I think this one's also an interesting one. Hair dye or hair straightening chemicals can cause breast cancer. Is that true or false? Lots of people saying false, a few people saying true. Okay, I'd say maybe about 75% of people say it's false.
So for straightener chemicals, you're talking about things like relaxers?
Yes, relaxers, yeah.
Yeah.
Anything that you put on your hair to colour it or to straighten it.
Excuse me.
Yes?
I think the chemical in those dyes will damage.
Say that again, sorry.
The chemical.
Yes.
Yeah, I think it has a lot to do.
Oh, so you think it's true?
Yeah, I think so.
Okay, so what was everyone's answer? Okay, so a bit of true and a bit of false. What's the answer? So it's actually false. So hair dyes and hair straighteners, there's not a solid link with the breast cancer. Yeah. So this is the
It can cause more breast cancers, especially fibroid for women.
Okay.
That's what happened.
I'm not sure about that. We have actually a GP staff here. Do you know any of this like fibroids and yeah, maybe we can find out for you a bit more.
Excuse me.
Yes.
Even the dye that you put in your hair, sometimes when the agency use it to straighten the hair,
Yeah.
it damages your scalp.
Yeah.
You feel that burning.
Yeah.
You feel that burning sometimes.
Yes. I think you're right. So the chemicals can affect our skin, it causes irritation. But the chemicals Thank you. Sorry guys, I promise I won't take too much more of your time. It's really important to know that that's actually before the 1970s. Hair dyes, some hair dyes did have some chemicals linked with cancer before the 1970s. But due to this country, the legality, so these companies have removed any carcinogens, the chemicals that are linked with cancer, they have removed them. So hopefully most of the products that we buy in this country have not got those chemicals in. But before the 1970s, there was a possibility that some of the chemicals were linked to cancer. But during our everyday lives, we come into contact with many chemicals like cleaning products, cosmetics, plastics, and it's actually quite important to know that actually some of these chemicals do contain something called endocrine disrupting chemicals. I don't know if anyone's ever heard of that before, EDCs. Don't worry, this is very new to me as well. So some of these chemicals can disrupt our natural hormones in our body, which can be linked with cancer. Yeah. So there is more research happening about that, and I do have a very useful leaflet which I can share the link with you after if you want to read more about it. And it tells you kind of useful things like what kinds of products to avoid in your household or your bathroom to make things healthier.
Those chemicals, it goes up in your brain. If you notice sometimes you use it then, it causes you to sneeze.
Yes, it's really irritating.
Yeah.
Well, while you're on the subject, what about false hair?
False hair.
I'm not sure if this is any of the breast cancer. I think you're okay. the main message I want you to take away is that most of the hair dyes and chemicals that we have for our hair now in this country should be safe. The government has removed those dangerous chemicals, but there is some chemicals and some everyday products that we have that might disrupt our natural hormones, which can be linked to cancer. And I don't want to worry you about that, because we're exposed to many different chemicals all around us at any time. But if you're interested to know more, I can share an information booklet with you that you can have a look at online after. Okay, this is another statement. Do you think it's true or false? Only female staff perform the mammograms at breast screening. Okay, so most people say true, some people are saying false, and some people think a man does the screening. Okay. What's the answer? So it's true, only females that perform the mammograms. I think actually the ladies, the people are saying that it's a man. I think you might have missed the first bit of the presentation. So don't worry. When you go to your screening appointment, it will always be a female mammographer that does your X-ray mammograms.
If a doctor is just checking for lumps, would that still only be a female?
No, that's a different thing. So in our breast screening program, when you're invited, you will always see a female only. But if you are at home and you find a lump yourself and you go to your GP, if your GP is a male, it may be a male that examines you. But you can request a female doctor. So if you don't feel comfortable, request a female GP. We have Steph here as a GP who will answer some questions as well at the end. What's helpful for you to know is if you do get called back for more testing after your mammogram, if they might have seen something on your mammogram that they want to investigate more. Sometimes we have male and female doctors or consultants in that clinic. But don't worry, if you prefer a female, you can request a female. But when you come for your screening appointment, it's always a female. We don't train male mammographers in this country.
Not yet.
Okay, this is the last statement. Do you think it's true or false? Breast screening prevents cancer. We have about 50-50. Some people say yes, some people say no. Okay, so it's no. So breast screening does not prevent someone from getting cancer. However, as we mentioned before, it helps detect early cancer. Yeah. So this means a better chance of survival. So having a mammogram doesn't stop you from getting cancer if it's already there. It just helps you find it earlier. I was talking a little bit about stages of cancer earlier. So stage 1 is a very early stage of cancer. So this is what the mammographer, the X-rays will pick up. And if you find it in stage 1, you have a 98% chance of surviving for more than 5 years. So most people will survive if it's found at a very early stage. However, if it's found at a later stage, you know, I was talking about some of our populations from the Black African and Black Caribbean populations and the South Asian populations are often getting diagnosed at a later stage, stage 3 or 4. And it's only 26% of those people will survive cancer for more than 5 years. So you can see how much of a difference it makes to find the cancer earlier so you can survive.
Survivor.
I think you missed it. You wouldn't hear what we were talking about. Yeah, it's okay. So we have lots of differences in cultures and ethnicities. We have different beliefs, different traditions, and there can be barriers such as language barriers, cultural barriers. So sometimes some cultures might not have awareness that we need to go for screening. Or it might not be culturally acceptable to go for screening, or they might feel it's not important for them. So there's lots and lots of different reasons why some populations might get diagnosed later. But if you want, we can have a chat about that later as well. We have a bit more time. Has anyone heard of any other myths? Has anyone heard of anything else that might cause breast cancer that we want to talk about? Anything unusual? Don't be scared. This nothing is a silly question. Anybody heard of anything else causing breast cancer? Yes.
Yeah, from my cultural background, Nigeria. Yeah, from my cultural background, Nigeria, I've heard that if you borrow people your touch or stuff like that, you can contact cancer. But I think it's a myth.
You say you're people at all?
Like you borrow people things you look like your shed or things like that, that you might contact cancer.
Yes, actually, did everybody hear that? So Lucinda said in her culture in Nigeria, some people think you can catch cancer from sharing clothes. Has anyone else ever heard that? What does everyone think about that one? Do you think that's true or false? Yeah, it's false. Yeah, it's definitely false. And you remember the first slide we saw, the cancer starts growing cells inside the breast. It's not an infectious disease where you pass it from person to person. Yeah, so yeah, that's definitely false. Has anyone else heard of any other strange myths? Anything that causes breast cancer?
No. I think if you get some if you get sufferance and depression, you fall on the street, especially if you go down on your face and if you hit your breast, you can develop cancer.
Oh, okay. We have that myth actually. Does anyone remember if you injure your breast and what was the answer to that? Does anyone remember? If you injure your breast, you know that causes breast cancer. False, yes. So if you fall over and hurt your breast and injure your breast, that does not cause breast cancer. It might cause a sore lump or a painful, but it does not cause breast cancer.
And you get along with coming your breast.
Yes.
You hit that breast, and the breast is very delicate.
Yes.
So then, you know later on, it won't become cancerous.
Yeah. So actually, this is what we talked about before. Is it does an injury does not lead to breast cancer, but it might cause a lump, but that doesn't mean it's necessarily breast cancer. So if someone does injure their breast and they have a lump there, it's best to get that checked just in case. But most of the time, the lumps can be non-cancerous. Okay, but I think we'll move on. This is just very, very quickly. I mean, how are people feeling about breast screening? Are you feeling motivated to get yourself screened? I think there's more benefits there's more pros and cons. So I just want to kind of just briefly go through what we've talked about. An earlier diagnosis means a better outcome. It's very quick. It's only 6-minute appointments. So you're in and out quickly, you go back to work, you go back to do whatever you want to do during the day. It's completely free. It's the NHS. Yeah, we don't charge you any money. Also, it might give you reassurance. If you get that letter through, somebody today had a letter to say everything was fine, and it's giving that person reassurance today. And it might save your life. Thinking back to the video that you saw at the start, all of those women that were screening said that they wouldn't be here today unless they screened. But I do want to kind of talk about some of the things you might need to think about, because you have a choice if you want to attend screening or not. But we recommend that every person with breast, a woman or someone that's assigned female at birth, should have breast screening when they're 50. But the things you need to think about is it might be painful or uncomfortable for you.
I hate it, but I've done it.
Oh, well done, well done. Yes, it's just a short bit of pain. And actually, some people say it's not painful at all. So,
that much, excuse me, that much that goes down on the breast, and sometimes it squeezes. Yes.
Yeah, it can feel a bit strange, yeah. But also, just to let you know as well, so the mammograms, they're not 100%, they can't find every single cancer. There's very small chances that they might miss some cancers. So that's why it's important to keep going to the regular screenings. But it also, cancers can occur in between those mammograms as well. So in between,
How long do they stop giving you a mammogram?
and we're going to talk about that next. It's 70, but you can carry on. So it's from 50 upwards, yeah, we'll go to them. But also, if you're screening, it might give you anxiety, worry about your results. That's something whether if you can deal with that, great. Some people worry about radiation exposure from the X-ray. I don't know if anyone has thought about that or is worried about that. Yes. Has everybody been on a plane to fly somewhere? But you have to really fly your phone somewhere. So every time we get on a plane, that actually exposes us to radiation. Very, very small amount. And it's the same as an X-ray. Radiation is very, very small amounts. And it can save you getting lots and lots of X-rays over time. It can very, very, very slightly increase your chances of cancer. But it's the benefits of screening outweighs the risk. And then the other thing you need to think about, some people might be treated for a cancer that otherwise it might not have affected within a lifetime. So that can cause unnecessary treatments and stress and anxiety. But what we say overall is much more benefit.
That last one.
Yeah.
Yeah.
Yeah, is it, you feel that one? Yeah, but most of the time, if something is found, it's better to get it treated in case, yeah. So the NHS they'll always treat, if it's a cancer, they'll offer the treatment. Yeah. Next. Okay, so we're going to talk about who can attend breast screenings. I know some people ask how old do you have to be for screening, and can you screen through a man? So the National Breast Screening Programme in the whole of England, and Scotland and Wales and Ireland, every single woman will be invited for their first breast screening when they're 50, or in between age 50 and 53, you'll get your first breast screening appointment. And then you'll get invited every 3 years to come and do another one until the rest of your life, if you like. When you reach 70 or 71, our national programme, they stop sending you an invite letter, but you can still come, you just need to ring and book your own appointment. So if we have any ladies here over 70 today, we'll give you a card with our code number on, and you can call and book yourself an appointment. If anybody has missed an appointment, it's very easy, you don't have to wait another 3 years for your next invite. You can just call and book your appointment. So we can help you today if you want to call the hub, we can give you the number, we can support you with that. So for anyone under 50 or if you're a man, you're not automatically invited to the breast screening programme because you're not classed as a high risk. And do you remember me talking about women aged 50 and above? That's the highest risk of people in our population. But it doesn't mean that men and people under 50 shouldn't be breast aware, because if you remember me saying before, about 5,000 people under age 45 get breast cancer every year. So it does happen to younger people as well as men. So if you find something unusual with your breast or your chest or your pecs, you must book a GP appointment as soon as possible. And your GP, they can refer you to get an assessment within 2 weeks to check if there's any signs of cancer. So it's a very fast process. As long as you get the GP appointment booked, if you notice anything unusual, go to your GP. If anyone has a family history of breast cancer, if anyone has had it, you can go to your GP and discuss that, and they will do a risk assessment, and it may be that they refer you to do genetic testing.
Yeah.
And if you're carrying a faulty gene, then it may be that you're offered screenings below the age of 50 or more regular screenings. Okay. Has anyone got any questions about that? Yes.
My question is, although the screening is only 6 minutes,
Yes.
it is very painful. Are there any ways of them developing something like the CT scan or the MIR scan, which will make life a little bit less painful for women?
Yes. So there is a few different tests, but the mammogram is more accurate. Yes, they have I can answer this question.
I was just gonna say that there is currently research around even MRI for breast screening. So they are looking at other ways, because obviously we do know the mammograms are uncomfortable for some of our women. So there is research taking place, and hopefully, probably we could use MRI in the future. Yeah, thank you.
There's another question.
Yes.
Can somebody who's been through chemotherapy or radiotherapy be cured of breast cancer from the radiotherapy they already had or not?
Do you mean if they're fully cured?
Yes.
Yeah.
If it does cure,
It depends on the area of
if
target.
it does cure through that, I think it will, sometimes it comes back aggressive.
Sorry, could you repeat your question?
Yes, I said the breast cancer. Yeah, if the TCI, you can give you the radiotherapy or even the chemo, I think some of them really comes back aggressive.
So most people after they've had chemotherapy or radiotherapy, they are under surveillance by the cancer treatment team for about every 6 months, and then they extend it over a year after a certain time. So you'll still be surveilled or seen every so often by the cancer team after you've had that treatment to see if it does come back. Sometimes it does come back.
Yes, because that thing is so stubborn. When you think it's gone, it's just ready to come back. Yeah, so stubborn. Yeah.
Yeah. My question was more to do with the other types of cancers that people have had chemo or radiotherapy and not necessarily straight with breast cancer, because some treatments you do it and then you go into remission and then it doesn't come back. Some cancer, some. I want to know the effect of having those treatments, whether it can affect the detection of breast cancer or can help to cure.
So it's just in the sense that if you didn't know you had breast cancer?
Exactly, yes.
That's a little bit more tricky to answer, because if you didn't know, but you had chemotherapy or radiotherapy, in general, hypothetically, yes, it could cure it, but most of the treatment that is given is depending on the patient, depending on the cancer. So if it's not specifically for the kind of breast cancer that you have, it might not cure it at all. Yeah. It's just different causes, different symptoms.
Can I ask a question? Myself, too. But I've been treatment for any type of cancer, and it's not being cured. It can come back again, isn't it? How would it done?
There's always the likelihood that it can recur.
Yes, we have another question.
Can benign lumps, like sometimes I hear benign lumps, and then it turns to breast cancer?
So the question was, can benign lumps turn into breast cancer? I don't think they can, but I think Steph can. So if you had a check over and someone's confirmed it's a benign lump, I think it's quite rare that it will turn into breast cancer, but that's okay.
It depends on the type of the benign lump. So there's some benign lumps that won't turn into cancer, and there's ones that are precursors that have the potential of turning into cancer. So it just depends on the.
Will they still be benign?
It still be benign, but it depends on the kind of lesion it is, whether or not it can turn into cancer.
And then she said, her age is 50.
Yes.
And at the same time, she said 5,000 in aging 45 is breast cancer. So if they don't do for screening, and then there's no, they don't have it in their family, how do they know that
You have to just keep checking. You have to check yourself and be breast aware. Yeah.
They're not 50 yet.
Yes, yes. So if you're under 50, the only thing that they can do if you're under 50 is just check yourself. Keep an eye out what's normal for you, and if you notice anything unusual, then book an HCP appointment. Yeah, I know it sounds a bit unfair. Maybe at some point in the future they'll lower the screening age, but at the moment it's just 50 upwards in this country. And so, how do you get your breast screening appointment? Historically, people have had a letter sent to their address at home. Yes, people are nodding. And so since spring, we have gone digital. Is it just in London or is it everywhere?
London.
Okay, so just in London, you will now get your appointment letter link through a text message or email. So I know not everybody has a smartphone or maybe you don't have an email address. Don't worry. If you don't open the appointment letter on your text message or email, it will still send you a letter to the post. But for the people that are looking out for their appointment letters, keep an eye out for a text message which says NHS breast or breast screening. The same for emails as well. So it's really, really important that we all keep our mobile phone numbers, our address and email addresses up to date with GP. And if you have an NHS app, you can actually update your phone and email address on there. So if you need to update it, please do it as soon as possible so you get your link for your appointment. So to actually see your appointment letter, you need to click on the link from your text or email, and it will ask you to enter a password. And so the password is set at your date of birth. So nobody will be able to access that unless they know your date of birth or unless they have the link. If you're due your breast screening appointment soon, it's the password is your date of birth. So for example, you were born on the 14th of December 1960, you would put in 141260 in 6-digit form, and then you'll be able to see your letter on a smartphone or your computer. If you don't have a smartphone, don't worry. If you don't, as I said, if you don't open the link, you will still get a letter sent to your address. So I think you're all Lambeth and Suffolk residents. Lambeth. So we have one screening site which is the nearest to you, and it's on Denmark Hill. It's I think maybe a few of you have already been for your screening. So it's, if you know where Nando's is and Cold Harbour Lane Junction, it's just before you get to Nando's and Cold Harbour Lane Junction. And it's a building. This is the entrance. It's a white store with a white and blue NHS sign saying breast screening. It's a very nice clinic. We have air conditioning and we have a lift as well. So if anyone has mobility issues or you can't get up the stairs, we have a lift and we have air conditioning. And when you're inside the mammography room, it's not, we can change the temperature for you. I think it's usually like warm, because if you're taking off your top, you don't want to be too cold. But definitely in the waiting room, we have nice air conditioning, we have a water fountain. This is our waiting room here. And we always have very friendly receptionists, always female receptionists as well. And actually we have Grace here, is one of the receptionists down in King's, who gives away. So Grace works at the King's Hospital site,
but the one that we do a lot of the screenings at is the one on Denmark Hill. So if you'll automatically get sent an appointment to your nearest clinic. So if you're living in this area, you'll get an automatic invite to Denmark Hill. But if you don't want to go to that site, maybe you visit somewhere else, or maybe you work in a different area, you can request a different site. We have 7 different sites across South East London. So you can, if you get your appointment, you can call and change the location. I won't go through all of them unless you want. Do you want me to go through where they are? And you remember back to the video of the lady getting her mammogram, and they were saying that you can make adjustments. So if you've got a learning difficulty or a disability, or physical disability, mobility problems, maybe you're in a wheelchair or you have crutches, or maybe you don't speak English as your first language, you're blind or deaf, or you're neurodivergent, we can make adjustments for you. So you just need to call us and let us know what you need. So you can have a longer appointment, or make sure your appointment is somewhere with a lift or step-free access, or you can change the appointment time and the location. You can bring a companion with you if you need some support. You can book a BSL interpreter if you're deaf, or you can have an appointment at the weekend if you need. So there is adjustments that we can make. So please do pass this message on to anyone that's worried about breast screening, that we can make things more comfortable for you. So just quickly about the results. So after your mammogram, you probably remember in the video, it says you'll get your results within 2 weeks. Sometimes it can take a little bit longer, but you'll usually get the link sent by text message or email as well, because our results have also gone digital. So you'll get your results letter on your phone or your tablet or your computer, and you access that with your date of birth and your password. And if you don't open the link, you will get sent a paper letter through your post. And this is just an example of what the text message and the email might look like. It will say NHS breast or NHS breast screening. So some people might be worried about what will happen if they find something on your mammogram, like the first X-ray that you saw very early on in the presentation. So if something is seen on your mammogram, they cannot tell you on the day because it needs to be assessed by a team of radiographers. But if they find something that looks unusual, then they'll ask you to come back in for an assessment appointment for further investigations. But this does not mean you have cancer. Lots of people might assume, that's it, I've got breast cancer, but it's not the case. It's really important to attend so that you can work out what it is that you need to do. So if you need to do extra tests, it might be that you need to repeat the mammogram, the X-rays, or it might be a different test like an ultrasound. Does everyone know what an ultrasound test is? You remember if someone's pregnant, you have the test on the belly. You can do the same one on the breast, and you can see symptoms on there. But also, you might need a biopsy taken, which means taking a small piece of the breast tissue to examine. And at this appointment, then there's female doctors, but there may be male doctors as well, but you can request a male doctor to see you. And going back to the original screenings, that's always female mammograpers, as we mentioned before, but at the assessment clinics, there might be male clinicians, but you can always request a female mammographer. Okay, so if you think of 100 people have gone for their screening, so all of these blue people here on the screen, and the orange and the green, this is 100 people that have gone for their mammograms when they were invited. So out of all of this 100 people, only 4 people need to get further tests. That's the assessment test. So it's not that many out of 100 people. And actually 1 person out of that 4 people getting extra tests will end up being diagnosed with breast cancer. It's 1 in 100. So, it's not so bad. So don't be scared. Is anyone surprised at that? Yeah. So most people have a normal result and they'll get called back again in 3 years' time to do more testing. And then 4 people need to do extra tests, like I was saying. Okay, we're almost there. Does anyone know what being breast aware means? Do you know what I mean? Yes, you should know your breast, yes. Anyone else? What does being breast aware mean? Yeah, so it's checking for signs and symptoms in your breast or your chest. Yes, correct.
And also doing prevention is better than cure.
Yes, prevention is better than cure. Yes, definitely. Thank you for that. So, there's lots of ways that we can check our breasts, and actually we recommend doing it once a month. Somewhere where you feel comfortable, maybe it's in the shower or the bath, maybe it's just before you go to bed. You can do it standing up or lying down. It's whatever you feel comfortable doing it, but to put it into like a routine that you do. So this is a little video that we're going to watch about how this lady, she checks her breasts once a month.
Wait, what do you say? That the shape looks the same? Big as the lumps? Nope, not thinking. Skin texture, nice, looking good. Hips, collarbone, next one, just the same. Try next bit. No discharge, no version, anything? No, we're good.
So this lady, she's just made it part of her routine. She's just getting ready for work and she's getting ready to go out. And it was very, very quick. And she knows what's normal for her. And she found it more comfortable as she got out of the shower, she's put a moisturizer on. So that was her routine. So you need to get yourselves also into the habit of doing this, and also men as well. Do you remember when we were talking about the lemons and all the different symptoms? So it's really just getting to know what is normal for you, and you need to touch, look, and check. Check for changes, and no matter what shape or size your breasts are. So it's very important that you check your whole breast area, including up to your collarbone, your upper chest, and also your armpits as well, because that's where symptoms can also appear. So just to run through what you need to look for again, this is just a refresher. So you need to be looking for a lump or swelling in the breast, upper chest, or armpits, and change to the skin, such as puckering or dimpling. Remember I was talking about the orange peel rash? Rash or crusting around the nipple. Unusual liquid or discharge from any of your nipples. A change to the colour of your breasts. It might look darker red or inflamed. Or a nipple change, for example, it might be pulled in or inverted, which is not usually normal for you. Also changes in size or shape of the breast as well. And we mentioned about pain earlier. Pain on its own isn't usually a sign of breast cancer, but if it's accompanied with another symptom or it doesn't go away at all, then it's definitely something to look into. And I was saying, if you check yourself once a month, that's great. You can sign up to get free text alerts. And we've given you some leaflets in your bags. There's a very good charity called Copperfield. If you text them, they'll send you a free text every month as a reminder. And we also have a little shower sticker as well that you should have in your bag, so you can stick on the glass of your shower or your bath or your wall, which just reminds you of all the symptoms and what you need to check. So if you haven't got one of those, let us know, because the bags might not have one of these in, not all of them. We did bring them. But we can drop some off next time we're here. So where do you normally get your sources of health information? Does anyone have a go-to? You go to Facebook, or you go to a website, or is it down the top with your mates? Where do you get your health information from? Do you want to see that? Yeah, oh, great. That's amazing. Thank you. Yes, the other thing about ATP, yes, they'll bring lots of organisations together. You'll get some health talks from professionals from different organisations, and you'll get real information. There's a lot of misinformation out there. Does anyone else get any information from anywhere else? Surgery, yeah. Yeah. That's a good source of information.
On television, sometimes
Yes.
people got problems, they go on television.
Yes, it's television.
Online.
Yeah. So they have like professionals talking about different conditions. Is there anyone else? Is anyone guilty of getting information from Facebook or TikTok or Instagram? Don't worry, I'm not going to shout at you. We're all guilty of it, and also Dr. Google as well. Yeah, so we all do it, also ChatGPT. But it's really, really important that you stick to proper, trusted sources because there's a lot of misinformation out there online. And some of these logos are some of the charities that we would recommend that you get your information from. So Copperfield is the last video that we watched. That was the video that they made. They've got some very nice information. Also, the NHS, South East London Cancer Alliance, who we have a colleague right here. Chris, did you have any institute? Yeah, this is Chris, by the way. I don't know if
No, I was at the beginning, yeah.
Okay. Also, there's a very nice charity, Black Women Rising, that do lots of work around cancer in Black women. Also, we have Cancer Research, Breast Cancer UK, Macmillan, Know Your Lemons, Breast Cancer Now, some other groups for Asian women, and also for LGBTQ plus I, so bisexual, trans, etc. So we would really recommend trying to get your information from social media and trying to stick to trusted sources if possible. Okay, final message. Thank you so much for all your attention. I hope I don't bore you too much. So, final message. Attend your appointments, screening appointments when you're invited, every 3 years. But look out for your first screening appointment if you haven't already had one. So it should arrive between the ages of 50 and 53. That's to the women. Keep your address, phone number, and email up to date with your GP through the NHS app. And if after today you think, I'm actually overdue my screening, or maybe you cannot have overdue scares and you've now motivated, you don't have to wait for your next appointment. You can call the hub today and book an appointment that suits you. So the number is here. We can, if you want to write it down, or we can write it down for you, we can do. So if you've missed an appointment, call to rebook. But also to be breast aware and check yourself once a month. So you've got your leaflets in your bags, you've got all the reminders that you need. Make sure you get into the habit of checking. And if you notice anything unusual with your breast or your chest, book a GP appointment as soon as possible. Don't delay, because it could save your life. And if you have a family history of breast cancer, book an appointment with your GP to do a risk assessment. And if you're over 70 years old, I don't know if I can't remember if I mentioned, but you stop getting automatically invited to the screenings, but it doesn't mean that you can't get screening. You just have to book your own appointment. So any over 70s, we have a little card with a number as well that you can call. And finally, living a healthy lifestyle is going to help prevent your risk of breast cancer. So being a healthy weight, making sure you reduce your alcohol intake, eat healthily, and make sure you move your body and that you're active. Thank you so much. We have a GP staff here who will have some time for questions and answers, or any of us can answer some questions that you have. I'll hand you back over to Ollie first.
Okay, so for Q&A this time, who has questions? I think everybody has several questions and that. So, you still have a question? You have a question. Anyone with questions? This is the time.
No, I think you want to done.
Oh, thank you. Thank you. So I'll just leave Dr. Steph. I think just give them a general, yeah, just say something. Oh, no, I'm going to give the mic to tell them. Okay, before the step comes up, I was just reminded that we have very beautiful samples. Yeah, so this is a normal breast. Anyway, I'm going to leave it to the experts to explain, but you could come forward to feel them and have an idea of what numbers look like or what those apples on the screen look like. Yeah, and if you want to have a chat with the team, please, that could be done after. So the floor is yours.
Just want to say thank you to the breast screening team. I would say my advice or just any takeaways from this is if you have any concerns about any symptoms that you have concerning your breast, any changes, even if you didn't see them here, you can always go to a GP and have it checked out, so it's safe than sorry. And early detection means that we have more options for treatment and saving lives, I guess. And I think I just had, you asked a question about milk ducts in men earlier. Men do have milk ducts, and the cancer origin in men is in the same place. So men as well, if you get yourself checked out, checked by the we've just seen, if you have any concerns about any changes there, then make sure you get seen by your GP. Thank you.
All right, thank you very much. Okay, I think we've come to the end of today's session. Like I said, if you want to have a chat with the team, please, the floor is open. We are more than happy to answer your questions. We'll still be doing the blood pressure tests in the building to the left when you come out of this space. And just as a reminder, our next workshop will be on the 18th of June. We'll be here. For those who came later on, we have some pink. Place this on your seats. It's a QR code that leads you to the workshop evaluation. Please kindly fill them out. If you need help scanning, just call our attention. We are more than happy to assist. Alternatively, if you're not comfortable using the QR code, we also provided the paper versions with pens and so on. Please do us all to fill them out so that we can know how to do our workshops and what else to do to make everyone comfortable. All right. Before we go, I just wanted to ask if we could please give this wonderful team another round of applause. We're very pleased. We are very happy to meet you. Well done. Chris, well done. Eddie, well done. Grace, well done. And to you all who came here today, give yourselves a round of applause. Thank you. Thank you.